Congressman, so pleased to have you with us today. It has been a good conversation. We're going to have a good conversation in our conference, and I welcome you. Our attendees today know, of course, that you're a member of Congress for nearly 20 years, that you are the senior Republican on the House Energy and Commerce Health Subcommittee, which I know well, and I think probably many of the people in the audience know. But also what they may not remember is that you also practiced medicine for nearly 30 years before you came to Congress. So you come to Congress with a lot of experience in healthcare and concern and interest in healthcare as well. So we hear from our physician groups and our health systems in our alliance who support Medicare Advantage that it really allows them to sort of practice medicine the way they always hoped, to be able to take time with their patients, to see them as frequently as they need, to coordinate care. That really just doesn't happen in traditional fee-for-service Medicare. So how does, of course, your own experience as a physician, as your own personal experience with Medicare, with your constituents, what is your view and that has informed your view and positive view of Medicare Advantage?
So I'll just take a little step back and point out that I am also a Medicare Advantage customer, patient.
I knew that, but I didn't know whether you'd want to tell everyone. So that's great.
And we know one of the, as you served, and you know, oftentimes people will say, well, why can't I have what you have as far as health insurance? So you know what, the good news is you can have exactly what I have. It's called Medicare Advantage. And I went in the open enrollment period and made the decision that this was something that actually offered closer to home the types of things that I would need. I didn't need to be involved in a Washington, D.C. Experience. I needed my doctors here in Texas. So I looked at what was available and found a great Medicare Advantage plan and have been quite happy since I turned that magic age of 65 and started down this path. I will say that when I think about healthcare policies broadly, and people say, "Well, what do you look at when you're looking at a healthcare policy? What's important to you?" And truly, cost and complexity are two of the things that I think you have to consider. Well, Medicare Advantage, of course, is part of the Medicare program, so it is something that we've paid into all our lives. It's not just a gift from the federal government, although it is heavily subsidized by the federal government, so there's that. But also on the complexity side, I will tell you that I found it probably as easy, if not easier, than any of the commercial insurance products I worked with. I was not just a doctor, I was also an employer and provided insurance to my health insurance to my employees and their families throughout the time I ran my practice. So I'll just say from those two standpoints, cost and complexity, Medicare Advantage certainly checks both boxes. I also think when people are just thinking about what's best for them, they do need to consider, and this is one of the things that I like about Medicare Advantage, is you actually have a lot of choices. And in fact, sometimes it can seem like you have too many choices, but everyone knows their own medical situation better than anyone else. So it's hard for us as members of Congress, it's hard for the people in the agency to be able to think about every possible medical contingency. So the good news is that you have the ability to do that yourself. Now, there are also people who can guide and counsel and concierges to help you along the way. But the good news is, because of the rich panoply of choices that are out there, people can actually construct a program that works for them. I will also confess, when I first got to Congress, one of the things that really bothered me, I hear people talk about pay for performance. Well, look, when I was a physician, there wasn't a single morning that I drove to work that said, boy, I hope I'm average today. No, you go to work every day to do your best work, do your best, put your best care out there for your patients. So I always kind of recoiled a little bit against pay for performance, but I also, and understanding that when the federal government is a payor, the federal government does have a responsibility to ensure that they are paying for the right things. And it creates sometimes a little bit of strife between the provider part of me and the federal government part of me and the patient part of me. But you've got to keep all of those in the proper perspective. Value-based care, sure. The federal government wants value for the taxpayer dollars that it spends. Value-based care, sure. The patient who receives the care wants to be certain that they only receive the care that they need, but that the care that they need is received, and it's received in a timely fashion, and it's of the highest quality. And then from a physician's perspective, no, I don't want care for patients that is not necessary or futile. But when I order the care as a physician, I want to be certain it's of the highest quality, and it's going to be available to the patient when I make that recommendation. So value-based care can mean different things to different people, but a better approach, I think, than the old pay for performance, because again, I always bridled under that designation.
Well, you make some many interesting points, which is that it's really fantastic that you're able to see it both as a beneficiary and from your constituents' point of view, obviously, and recognize that many beneficiaries do choose Medicare Advantage because it's more affordable, because it actually has extra benefits, and because it's simpler. The system is very complicated otherwise and very fragmented. So it's really giving you that opportunity for some care coordination and some real guidance sometimes, which of course is what we often need as patients. But it also offers choice. It is sort of a real public-private partnership. It creates that balance between government regulation and government oversight, because it's public dollars, as you point out, and some consistency and standards across the country, but also gives people choice. In fact, CMS just announced both the premiums for 2021 and the number of plans and kinds of plans. And what we saw is a $21 per month premium. It's lower, it's 11% lower than last year, and the lowest it has been in years. It's really extraordinary that Medicare Advantage has been able to, even in this time of worrying about high costs, keep costs low. And to your point, there are more plans, more choices tailored to your own needs and interests with the basic guarantees of Medicare, but then those other choices. So it is really something about that sort of opportunity to do both, is to give some government guarantees and to give people choices. So we appreciate your understanding of all that. In fact, this doesn't all happen by chance. It really is it's really been a lot of work's gone into Medicare Advantage, and changes have been made over the years. And you've been a part of that. And you're right, there's sometimes a little tug of war with ours and disagreeing, but this is a place where Republicans and Democrats really can come together. We've worked very hard at BMA to keep it a bipartisan, supported by both sides of the aisle. So, as we go forward and concerns about healthcare costs, how do you see Medicare Advantage either being a good example or really just an important part of the future of Medicare?
Well, it's all of those things that we've already discussed. I think another thing that we're sort of right on the cusp of seeing is the permitting patients with end-stage renal disease to be in the Medicare Advantage program. End-stage renal disease and the care of the end-stage renal disease patient has been important to me throughout my congressional career. We're right on the cusp of dealing with a problem with immunosuppressive drugs that's kind of bedeviled end-stage renal disease patients for a long time. So that will be good to get that fixed. But prior to the passage of the Cures Act a few years ago, the end-stage renal disease patient, the only way for them to be on Medicare Advantage was to have Medicare Advantage as a pre-existing condition, if I could use that term. If they had Medicare Advantage when their diagnosis was made, then they were able to continue. But otherwise, a newly diagnosed patient with end-stage renal disease who is going to be taken care of in the Medicare system didn't have Medicare Advantage as an option. But now they will, thanks to a passage of a provision in the Cures Act a few years ago. And that will be interesting to see how that works, and I know it will be studied by significant numbers of people and smart people, and they will tell us what we got right and what we got wrong in that. But what I'm excited about is it does provide another level of participation by the patient in their own their own care and in the processes that are going to basically. When you have end-stage renal disease, I mean that it becomes your life, unfortunately. But the ability to give a patient more flexibility, the ability to consider things like home dialysis, which in the past might not have been available to them. Very excited about the possibilities that are opening up there. and we'll learn a lot in the process as the other part of this.
Appreciate the work that you've done on that. We too are excited about what kind of changes might be made, what kind of innovations in care delivery. To be on renal dialysis for the rest of your life, unless you get a transplant, is really a daunting experience for just about everyone who faces it. And so we have seen in this, I hope it opens up opportunities for new sites of care, home dialysis, which apparently is done in other countries quite a bit, and we really do very little of that in this country. So to change some of that, other sites of care that might offer new options for beneficiaries. So thank you for your work on that. And yes, we will be watching all of it and see how that it works. But we're happy for the opportunity for these very complex patients. We also would like to see more and more work done earlier. So if you have chronic diseases, not to progress all the way to renal failure, obviously has to be a goal in this country. And hopefully this will stimulate some of that kind of additional work. I know nephrologists work hard to not let that happen, but more that we can do to actually make sure that people get the kind of care that they need earlier so that they don't end up with kidney failure.
Absolutely.
I know. Thank you for your work on that. Maybe just a final question. Hard in these day and age not to talk a bit about COVID, COVID-19. We all hope for the best going forward, but we also know that it's with us for a while. So what are your expectations or what you would call for either right now or just going forward to make sure that we are doing all that we can, the people who are listening, you know, and doing all that they can to really be able to tackle this pandemic?
Well, to your point, the preventive measures that each of us can take as individuals are important. I'm talking to you by Zoom, so we're not in the same room, and I'm not wearing a mask.
It's become the new normal.
Yeah, if we were face to face, then yeah, either social distancing or mask wearing is important. They both have a role to play. And I guess the other thing we've all learned through this is you need to wash your hands many more times a day than you thought necessary and more thoroughly than you used to. And that is another mechanism that we can all employ to reduce the likelihood of attracting the disease. But, you know, moreover, I just more broadly, and I know there's always, people are always eager to criticize one thing or another, but when you look at the lethality of the disease in March and April of this year, when it first emerged in this country, to where we are today, there's been a dramatic reduction. And of course, it affects the Medicare population. Some of the greatest risk is in patients who are Medicare age. So that reduction in lethality definitely affects that portion of the population as well. So the good news for people is that all of the work that has been done, and I really have been impressed with this whole of government approach, the Operation Warp Speed that we've seen in our committee. We've had an opportunity to talk to a number of the people that are involved in development of vaccines, medical countermeasures. I always get a little frustrated when you get close, like we are today with a vaccine. I'm like, man, if I was on the front lines, I'd want that today. So I feel the pressure that let's get this last mile done and get it out there and get available to people. But just taking the observation how the care has improved in really just literally the 6 months that this disease has been a known entity, and the medical system in this country really has responded extremely well. And just stress that we're going to get on the other side of this. We always do. This will be in our rearview mirror. I hope a little sooner rather than a little later, but it's a day that's coming and it's not too far off. And medical innovation that this country has, and we've been blessed to have medical innovators in this country. God bless them. We need them, and we need them to be at the lab bench right now. And let's create the next round of cures we're going to need for the next round of illnesses that we're going to find we encounter.
For sure. Thank you for your words of hope. Appreciate that. And thank you too for taking time to join us, even by Zoom. We really appreciate that your time to do that. And your leadership on Medicare Advantage. You have been someone we can count on. So look forward to working with you in the future. And thank you and be well.